There aren't enough diabetes specialists in the United States for everyone to see a diabetes specialist. So what that means is that the diabetes workforce in the US is the primary care workforce. 90% of people with diabetes in this country are treated by primary care providers.
I'm in a rural area. It's a population of 15,000. And our clinic attracts almost 30-40 mile radius patient. And it is very challenging.
Anybody with diabetes, you need somebody in your corner. When you're using that needle and you don't know what you're doing, you got to make sure those air bubbles aren't in there. And I'm looking at all this and I said, man, this is a lot.
I basically essentially said, you know what? I give up. I don't care. I stopped taking all of my medications. I didn't care about my diabetes. I didn't care about nothing.
Pour un diagnostic de diabète, le 26 mai 2021. Ça n'a pas été facile d'obtenir un traitement. Les défis que je rencontre à fin et puis l'adaptation au nouveau régime.
Diabetes, there's really no other condition out there. 24 hours a day, 7 days a week, no vacation from it, and no one pays you to do the job. It's overwhelming. And you ask someone living with diabetes, you know what? Take time off work, drive an hour or two, wait in the wait room to go to see a specialist who spends maybe 15 minutes with you and maybe blames and shames you about how you're doing with control. That doesn't make you feel really good as someone living with a chronic condition like diabetes. So to be able to stay close to home with a clinician who you've got a rapport with, empowered through the ECHO model to manage diabetes just as well, if not better, than the specialists, that's convenient.
We have a team of specialists, including a behavioral health specialist, a kidney specialist, a diabetes educator, and so forth, who connect virtually with a network of primary care clinicians in rural New Mexico. And they present real patients over the network and get feedback from their peers and the specialists that are tuned in on management. And the goal is that over time, the primary care workforce that are tuning in become more comfortable and confident in their ability to manage complex diabetes.
Dr. Finley said, you know what? She says, here's the deal. I think you're an excellent candidate for the pump. So we tried the pump, and I've enjoyed it. I love the pump. I'm very lucky to have found her to be my diabetic doctor. She's changed my life. She's turned me around for the better.
I feel like my patients are very lucky to get that input. So I get a chance to present, I get all their ideas, and then I can take it back to the patient and help them.
Talked about giving me a pump because they said it would help me. Once I got the pump, it was like the greatest thing in the world to me. It was like I went from eating hamburger to a steak.
So how can we apply what we've learned here in the US to other countries, especially low, middle income countries? That's the beauty of the ECHO model. It's flexible, it's adaptable, it's been proven to work in other countries.
ECHO nous a énormément aidé à mieux prendre en charge nos patients parce que avant de suivre la formation ECHO, il y a certaines notions qu'on ne maîtrisait pas. Il y a certains patients qu'on n'arrivait pas à suivre, on était obligé de les orienter ailleurs. Et depuis que nous avons bénéficié de la formation ECHO, ces patients nous les prenons en charge sans problème, sans difficulté. L'impact de la formation ECHO est vraiment énorme.
C'est de très bons soins. Très bons soins. Parce que depuis ma mise sous traitement, les urines ont intempestif la nuit, envie de boire beaucoup d'eau, envie de... Ça s'est passé.
I feel that Project ECHO truly is life-saving for so many people. I may have maybe 300-400. They would not have that access. They would have had to travel 90 miles to see somebody for 5 minutes. Spend all that money on gas, time. And it's just because of Project ECHO, I feel confident that I can take care of all these patients. I get referrals almost every day, 3-4 times a week from all over. And it's all Project ECHO.